Hi, I'm Dr. Mills, and I'm a psychiatrist in California with my own private practice called Freedom Psychiatry, because mental health is freedom. My practice focuses on achieving mental wellness through medication, nutrition, and lifestyle changes. I will be posting videos regularly that answer common mental health questions. Today, I got a lot of questions about chronic medical illnesses and the interplay between mental health concerns. So, I'll actually be having a friend of mine interview me from off camera, and we're just going to have a conversation about it.
Excellent, Dr. Mills. Here's one question. I have a chronic medical illness. Does that matter with treatment for mental health?
It does actually matter with treatment for mental health if you have a chronic medical illness. There are special considerations for people who have both types of illnesses. I actually love talking about and working with people who have both a medical concern and a mental health concern. You know, when you're suffering from things with both mind and body, sometimes people forget that that separation we have is actually not real. We are all one person and it's all connected.
Beautiful. Thank you. Here's another question, Dr. Mills. I have diabetes and also have been diagnosed with depression. What does that mean for my medication?
Well, it could mean several things. Really, what's going to be important is that you find someone who's knowledgeable about and comfortable with treating people that have both medical condition and mental health condition. So, your psychiatrist will want to make sure that whatever medication they prescribe won't have any unsafe interactions with the medications that you're taking for your diabetes. And that goes for any condition, really. Also, you want to make sure that your psychiatrist is going to give you medications that will, let's say, if they can, also help your medical condition, but if not, at least not make your medical condition worse. So for example, with diabetes, some of the psychiatric medications that we prescribe make it more difficult to control blood sugar levels. So if you have diabetes, we want to make sure we try to avoid those medications. As another example, some of the medications that we have in psychiatry actually calm nerve pain. I know some people with diabetes also get nerve pain. And so it would be helpful if your psychiatrist, if you do have nerve pain in addition, would be able to give you some medication that would calm your nerve pain and help your depression, and you wouldn't have to worry about taking opiate medications.
So, how am I supposed to talk with my medical doctor about all of this? What do I tell them?
Well, if you feel just overwhelmed with all of it, if you give your psychiatrist permission, your psychiatrist will be able to speak with your primary care doctor or your specialist that's treating your medical health condition. And that would be a lot easier for you, I would imagine. And you guys would all be on the same page.
That makes a lot of sense. I really appreciate all this good information that you're providing, Dr. Mills. I have one last question for the day. I have a rare medical condition. Can I go to any psychiatrist for my care?
Well, most psychiatrists are comfortable with common medical conditions. Some of them may or may not be comfortable while treating your mental health conditions at the same time as treating a rarer disorder. Really, what I recommend is just to ask questions. If you're interviewing a new psychiatrist, ask them how comfortable they are treating your mental health concerns while still paying attention to your medical conditions. You know, even if you already have a psychiatrist, ask them if there are any unsafe interactions between the medication that they just prescribed you and the medications you're already taking. Really, I think the answer there is just ask questions and you'll get a sense of how comfortable the psychiatrist really is with doing everything.
That's beautiful. Thank you so much, Dr. Mills. You've been very helpful.
Thank you. Thank you very much. This has been a joy for me with talking about the chronic mental health concerns and the chronic medical illnesses together. So If you would like me to be your psychiatrist that specializes in the interplay between medical conditions and mental health concerns, please go to my website, freedom-psychiatry.com, click on the contact button, and schedule your free 15-minute consultation with me, Dr. Mills. Thank you so much for listening. Have a great week, and remember, mental health is freedom.